Schools are beginning to reopen around the country, and despite efforts to socially distance students, states returning to the classroom are already reporting coronavirus cases. CBS News' correspondent Adriana Diaz is in Chicago, where earlier this week, that city's mayor said in-person learning is too risky for area public schools.
For schools reopening tomorrow, the routine morning drop-off will be masked by something new.
You got to find the right one to breathe right.
Face coverings are required in Enterprise, Alabama, and they'll be mandatory in September for New York City schools, which just got state approval to split the school week between in-person and online classes. It's one of only 2 of the nation's 10 largest school districts offering some in-person instruction. All others are strictly online. Of the 21 school districts reopening Monday, 8 will be in-person full-time, mostly in the South. The patchwork of plans nationwide is spurring debate and division. Elkhart, Indiana scrapped its virtual learning plan hours after parents protested. Chicago also reversed course, but with schools now starting online instead of a hybrid plan. Chicago mom Julia Devetsky worries her 6-year-old daughter Hazel will have too much screen time and too little socialization.
I know if she goes to virtual learning full time, it's going to be damaging for her forever. So I just don't want to do that. And it's sad.
Nationwide, parents are somewhat split. In one poll, 44% surveyed say it's safe to send children back to school, but 56% do not. The divide skews among teachers. A separate poll found that 82% are concerned about in-school instruction. Remember this photo of a crowded hallway and few masks at a Georgia high school? Well, that same school informed parents yesterday that 6 students and 3 staff members have tested positive. In Mississippi, more than 100 students are under quarantine in one district. At another, a teacher and assistant football coach died last Thursday. 42-year-old Nakoma James was self-quarantining when school started, but he had spent the summer training football players. That Mississippi school is now contact tracing to determine which students may have been exposed. Back here in Chicago, there are concerns that remote learning will exacerbate inequalities. The city's announced plans to help bridge technology gaps and support parents who need childcare. Margaret.
Adriana Diaz in Chicago. Thank you. We want to go now to Hartford, Connecticut, and Governor Ned Lamont. Good morning to you, Governor.
Good morning, Margaret.
You decided, or you said back in June, that you wanted schools to reopen for in-person learning. Dr. Fauci visited the state this week and said the state should reopen. I'm wondering what your plan is to keep schools open. How do you contain asymptomatic spread, and are you regularly testing teachers?
So first of all, we are one of the first states in the country to close down schools. And we've been very cautious as we reopen the rest of our economy. And Dr. Fauci's been helpful. Scott Gottlieb, your next guest, very helpful. Kept a very low infection rate, about 1%, one of the lowest in the country over the last 6-7 weeks now. So I think if Connecticut can't get reopened, I don't know who can around the country. And we're doing it led by public health, making sure everybody's wearing the mask, making sure that we have the plexiglass where needed. Cohorting so that one 5th grade class doesn't party with another 5th grade class. And I think we're going to give our kids the best shot for in-classroom education.
Well, what about prioritizing testing? How do you stay open without regularly spot testing students and teachers?
Well, what testing does is tells you whether or not you were infected. As you pointed out in the previous shot, you know, many people are asymptomatic and contagious before they are tested. So we have to watch out for that. We have 160 testing centers. Any teacher that wants to can go get a free test, recommending maybe some of them do that before the start of the school year.
Okay, so it's not currently part of the plan, but you're saying the state has access to tests. I want to ask you, though, about something your office pointed out to us, which is that 143,000 kids just simply did not log on for remote learning back in the spring, in March, April, and May. Do you know how much damage was done? And if you have to shut down and go remote again, how do you avoid these kids getting lost?
I think I do not want a lost year. And when everybody says, let's not go back to school until it's perfectly safe, until we have a vaccine, until 100% of the people are vaccinated, I worry that could be a lost year of education. But in the meantime, we do need a backup plan. So we've bought 100,000 Chromebooks. We're getting them installed in every kid's home that doesn't feel comfortable getting back to school. The teachers' homes, if they don't feel comfortable getting back, expanded Wi-Fi, so those kids can connect at least with their classmates over Zoom.
But what about those kids who just didn't log on at all in the spring?
It's a tragedy. We made it available to everybody we could. But again, it requires parental supervision, requires a lot of effort to make sure everybody logs in. Right now, we're going to have a telephone backup, better coordination, I think, with parents, but it's by no means perfect.
The president, as you know, announced these executive actions yesterday after Congress didn't come to an agreement. And his announcement calls for states to provide $100 a week for every unemployed person in their state, on top of what he says they're going to redirect from FEMA to make up for the expired federal boost. Does Connecticut have that funding to kick in?
Look, that would cost us about $500 million between now and the end of the year. I could take that money from testing. I don't think that's a great idea. I could take that money from mask and disinfecting for our schools. I don't think that's a great idea. In fact, I think the president's plan is not a great idea.
Well, how long would it even take you to get that up and running? I mean, what's going to happen to the unemployed people in your state who just saw $600 a week disappear?
Well, I mean, remember, we are continuing to provide them the state unemployment compensation,
right,
which is, $450. We're talking about the extra $600 that the federal government put on is sort of a bridge. They did that a few months ago until we got our economy going. Let's face it, our economy in Connecticut is going better than most other places, but there's still, tens of thousands who can't get a job. And many of them in bars or the such, there's no job available to them. So there has to be some sort of a cushion.
You spoke to the president this week. Connecticut has been hit hard, I know from my own family members, about power outages largely across the state due to this tropical storm. Has COVID slowed down the response to this storm? When are the lights going back on?
I'd say we were hit hard by this tropical storm. And we lost almost half our power across the state. And then you realize that means water treatment centers and nursing homes and a whole variety of real emergencies that have to be put out. In the meantime, we're bringing in thousands of contractors from around the region and around the country. And you're right, in the middle of a COVID pandemic, hey, I got a quarantine on people from South Carolina. Please come on up and fix our wires. But we're getting people tested and we're fixing the wires. Number one, safety. We got to get electricity back on.
So COVID has slowed down the response. And just to button up, I want to make sure I totally understood what you said there on unemployment. Is the bottom line for people in Connecticut that they just won't get any additional money on top of their regular state unemployment payment?
Yeah, Margaret, I wouldn't say COVID slowed down our response on the electric hit at all. And
well, you just mentioned having a quarantine crews.
No, we're not quarantining them. They're essential workers. We're getting them back up on the polls as fast as we can. Essential workers. What was your other question?
I just was buttoning up what you said on unemployment. You said the president's plan is not a good one. Are you telling people that they just won't get any additional money on top of what's already being provided?
Well, they're surely going to get additional support from the state of Connecticut. I would like to see the federal government step up, extend the unemployment true-up a little bit longer, let people get on their feet. What I'm doing here at the state level is, in particular, rent relief. I've got, tens of thousands of people who fear eviction. We have an eviction moratorium. We put money in place to help them negotiate with their landlord so they can start, paying down their overdue to the landlord.
All right, Governor Lamont, good luck to you. Thank you for your time. We'll be right back with Dr. Scott Gottlieb. Stay with us. Welcome back to Face the Nation. We go now to former FDA Commissioner Dr. Scott Gottlieb. He joins us from Stamford, Connecticut this morning. Good morning to you. I know you've been dealing with power outages in Connecticut as well. So I thank you for coming on today. I want to ask you this overall number. It seems stunning. 5 million coronavirus cases in the United States. 2.5 weeks ago, you predicted that by the end of the year, we could be at 300,000 deaths. Is that still where you think we are headed?
Well, we're definitely going to be somewhere between 200,000 and 300,000. And whether we're closer to 200,000 or closer to 300,000 depends on what we do and how this evolves. We've now had 2 waves of this epidemic, the New York wave and now the wave through the Sun Belt, which is receding, although Texas is showing signs of an uptick, at least in the last week, and that needs to be followed closely. We're probably going to have another wave. And the concern now is that this has become so pervasive across the country that it could start to infect more rural communities that have largely been untouched to date and probably are a little bit more complacent because they have been untouched, but are still very vulnerable because the infection hasn't been there. And if this does become more pervasive across the country, and it's not just in the urban centers, but also in more rural parts of the country, that's going to be far more difficult to control if it's more widespread. And we're seeing indications of that right now, the way it's spreading in the Midwest and the West.
When does someone who has COVID stop being a risk to others?
Well, the data shows 10 days after the onset of symptoms, you're no longer shedding virus that can cause someone else to become infected. So you'll continue to shed virus for a persistent period of time, but when that virus has been cultured, it hasn't grown, which means it's dead virus. And so right now, the recommendation is that 10 days after the onset of symptoms, if those symptoms have resolved, if you don't have severe illness, then you're no longer contagious. Previously, we were saying about 2 weeks, but the more recent data outlines about 10 days.
So we still have that question of, what if you just don't know? And since 40% of cases, according to the CDC, are asymptomatic, you don't really necessarily know who is carrying the virus. So you've talked about the need to increase testing and to improve it. Should there be a requirement that teachers get tested before they go into a classroom, that anyone going back to the office full time get a test?
Well, look, ideally, we would have that. If you look at what universities are doing right now that are reopening for on-campus learning, they're implementing widespread testing. They're testing students 2 or 3 days a week. We don't have the resources. We don't have the capabilities right now in most districts to do that. And that really is the bottleneck. We need to implement more low-cost tests that can be done at the point of care or at the point of school or work. There's going to be a saliva test that's hopefully coming on the market, going to get an authorization from FDA in the next week, and that will provide more access to testing. But right now, we don't have the testing available to implement the kind of oversight that we'd like. It is the case that if you're asymptomatic, you're less likely to spread the virus. CDC models that people who are asymptomatic are about 50% less likely to spread the virus, and you're probably most contagious right before you develop symptoms. And that's really what leads to these super spreading events. People don't know that they're sick yet because they haven't quite developed symptoms. They may be a day away from developing symptoms, and they go into a confined space, and it leads to these situations where 1 case can lead to 30 cases. So after you've had symptoms for a number of days, your infectivity, your ability to spread the virus probably declines.
We've seen, when it comes to schools, we've seen these really troubling reports this week of a few children who have died after testing positive for COVID. You've said time and again, children are not immune. It is just not clear what the impact of the virus is on them. What more do we know at this point? The president keeps saying they're immune, and we know that's false, correct?
We need to have a degree of humility. Children are not immune to this virus. We have seen bad outcomes. The CDC recently documented 570 cases of the multisystem inflammatory syndrome in children. There's more cases that are accruing. We've seen children die. There's 86 kids who've died from this and thousands that have been hospitalized. And so this is a risk in children. We haven't fully characterized that risk, and we're learning new things about this virus all the time. There's been data in the last few weeks that shows that the virus is having impacts on the hearts of adult patients, causing inflammation and some long-term sequelae and cardiac symptoms in adults. Previously, we didn't really understand that or know that. And so we're learning a lot about this novel virus all the time. We need to have a degree of humility about the risks. We need to try to protect children. So if we do reopen schools, and I believe we should, we need to do it with a sense of caution. This is complicated by the fact that there's been really a mixed experience when it comes to reopening the schools. We've seen some countries successfully do it. Germany, the Netherlands, Denmark have successfully reopened schools, albeit with a lot of measures to try to control the risk of outbreaks. Sweden left their schools open. But on the other hand, Israel reopened schools, and it led to outbreaks that then led to a resurgence nationally. And we've seen outbreaks in summer camps, a situation in Georgia and Missouri where we've seen large outbreaks among kids in summer camps. So we need to try to learn what went right, what went wrong, and as we step forward and try to reopen the schools this fall.
This week, the State Department warned that Russia is spreading disinformation about COVID, specifically vaccines. How should we understand this in terms of how vulnerable our country is?
Look, I think our country is vulnerable to this pathogen because we have unique risks owing to our federal system, owing to our culture. And we also have some vaccine hesitancy. So it's going to be very important to imbue confidence in the vaccine when it eventually does come through the authorization or the approval process by FDA. So I think we're vulnerable to that kind of information. The other thing to think about here is that this has now posed an asymmetric risk for the United States. Other countries looking in now can conclude that a respiratory pathogen poses a greater danger to the United States than perhaps other nations that have been grappling with this more successfully. And so it was always thought that a rogue nation would never unleash a pathogen deliberately. And I'm not saying this was a deliberate pathogen. Right. By everything we know, it was naturally occurring. But it was always thought a nation would never deliberately unleash a pathogen that can blow back on them. That thinking might have to be adjusted now that this has posed such an asymmetric risk to the United States relative to other nations, that some of which are our adversaries.
Thank you very much, Dr. Scott Gottlieb. We'll be right back. Joining us now is the President and CEO of the Federal Reserve Bank of Chicago, Charles Evans. Good morning to you.
Morning, Margaret.
It looks like talks have completely stalled on Capitol Hill. There is no emergency aid package on its way to the American people. What is the impact of this failure on the economy?
Well, I think that's a very important and unfortunate development. I would say that fiscal policy has been unbelievably important in supporting the economy during the downturn that we've been experiencing. The economy closed down in March and April, and fiscal policy swung into action very quickly with the CARES Act, and that's helped ensure that people could stay at home, be safe, pay their rent, increase food security, all kinds of things for vulnerable populations. And now that continues to be important because we've not got control over the virus spread. I think that public confidence is really important, and another support package is really incredibly important.
Yeah, you said it's not the job of central bankers like yourself. It's up to fiscal policy, the lawmakers. So even with what the president has announced and the questions around the legality and practicality of it, does this basically mean we should just assume there are going to be significant cutbacks in the middle of a recession? And what does that mean for increases in job losses?
You know, as you look at the economic outlook, there are some negative scenarios, and the ones that are, most pessimistic involve not supporting state and local governments. I think you heard the Connecticut governor say that if he has to put 25% support against the president's executive order support for unemployment insurance, then that's going to cut back on other things. States have to balance their budgets. They are experiencing reduced tax revenues, and so there will be employment reductions. State and local governments account for about 10% of employment in the United States, and so that's really another leg down, I think. Paycheck protection has been very useful. Extending that to small businesses also would be very helpful. In Chicago, we've had some panels. We've talked to people in neighborhoods, middle income, minority neighborhoods. And according to Stacy Young, the Preservation Project, she's indicated that unemployment insurance has really helped low income workers pay their rent. They've been able to, in those neighborhoods, small businesses or landlords, and so that keeps the money in the neighborhoods and provides better food security. I think that, as Scott Gottlieb just mentioned, it also spills over to rural and exurb areas too, because they're also hard hit. So it's, widespread support could be very beneficial.
So the official unemployment rate is at 10%. What do you think the actual is, and where do you think it's headed, given what you just laid out?
Undoubtedly, you know, it is somewhat higher. It doesn't capture all the people who'd really like to work and somehow don't fill out the surveys right. I think there's a percentage point discrepancy. I think it also, there's a huge amount of inequality as it's experienced according to different racial groups. And so Black unemployment is over 14%, Hispanic unemployment is over 12%, white unemployment is 9%. So that inequality gap has persisted. And I think that providing more support, the Fed has been providing accommodation. I think if we got the kind of support that we needed as quickly as possible, got control of the virus, perhaps all the people who were sent home to stay safe could be brought back by their previous employers. We are down 12.9 million jobs since February. If most of those could go back, we could enjoy low unemployment like we experienced at the end of 2019.
To that point, your colleague in Minneapolis, Neil Kashkari, was on this program last week, and he called for a month or 6-week shutdown to get the kind of contact tracing in place to do what the Northeast has been able to do. Do you agree that is what is needed?
You know, I think a very strong program like that would have the opportunity to get on top of the virus, but it would come at quite a lot of hardship for small businesses. It would require tremendous fiscal support. If the national U.S. government were willing to do that, I think we could knock down the virus spread the way that Scott Gottlieb and others have said is so essential. What we need is public confidence so that people feel good about going back to work. They feel safe. They can go out to retail establishments and enjoy leisure and hospitality and activities, put more people back to work. So while that could work, I'm not optimistic that that would be actually adopted. So I think that resources for testing, tracing, isolating people, trying to get control of the virus so that we can get it down and then go back to enjoy the type of activities that in Germany they're experiencing and in Asia.
Yeah. Thank you very much, Mr. Evans, for laying out for us what you're seeing out there. We will be right back. Before we leave you today, we want to take a moment to remember the life of a trailblazer in journalism and a member of our Face the Nation family. Mary Hager, the mother of our executive producer of the same name, passed away on Tuesday. She was one of the first female reporters at the Palo Alto Times and later worked at Newsweek magazine here in Washington, covering science, medicine, the environment, and space. Her daughter and our executive producer says her mother was both the smartest and the kindest person she had ever known, and she will be dearly missed. That's it for us today. Thank you all for watching. Until next week, for Face the Nation, I'm Margaret Brennan.